I'm Dr. Steve Kitchen. I'm an orthopedic surgeon who works here at MCH. Orthopedic surgery is the part of medicine that deals with musculoskeletal injuries. We take care of all kinds of fractures, sports injuries, and we have a specialty in doing adult reconstruction such as hip replacement and knee replacement. People often want to know why I became a physician. Originally, I was going to be an engineer. My first 3 years of school were spent in engineering until I discovered that I really didn't want to sit in an office all the time. I took some courses in human physiology and anatomy and really loved them. And then the summer after my third year in college, I spent working for a time in a hospital and shadowing certain physicians. At that point, it became really clear that I wanted to be a physician. It also is in my family. My father was a physician, my grandfather and my aunt were all in the medical field. Being a physician is many things. Sometimes it can be long hours, but it is very enjoyable. By far the most enjoyable thing though is feeling like you've actually helped somebody cure their problem, get better, feel like they can get back in action and doing the things that they want to do. When you come and have a visit in our orthopedic clinic, we think that you're going to leave feeling like you were listened to and that we developed a plan with you to take care of your orthopedic problem. Most orthopedic exams consist of a good comprehensive history about your orthopedic problem, a complete exam, and quite often some x-rays or other type of imaging studies. But in addition to that, we truly want to have time to listen to you, to hear exactly what it is that your needs are and what the problem is. We want to make sure that when you leave, you know that you've been treated to the best possible alternatives and that you understand exactly what it is that'll be happening. But the most important thing is to make sure that we understand what your problem is and that we communicate well so that you understand your alternatives in treatment. When I'm not working, I like to stay active. I've always been interested in sports, which is probably one of the reasons that I've gone into orthopedics. But I live in Colorado, so it's a great place to hike, go biking, and in the winter, of course, we ski. One of the other interests I've had over the years has been traveling, and I've combined that traveling with doing orthopedic care. So I've had the opportunity to go all over the world from Mexico to South America to India and Africa and do medical care and orthopedic care. The traveling really entails going to, most commonly, a missionary type hospital where they have very little orthopedic care. Often we'll join an indigenous physician there to train them in doing orthopedic procedures and taking care of some of their patients. Often it involves traveling into some remote areas, but it's always rewarding and it's always been fun, and it's a great way to see the world as well.